Hi, I'm Mercedes. I'm a nurse practitioner at the Center for Weight Management, and today I am here with Dr. Havilana, our medical director, and Otia Morris, our nurse practitioner. So today we're going to talk about testing for obesity and how we manage it. So we'll first start with Dr. Havilana on how do you determine what is a healthy weight for me and what kind of testing is there?
All right. Well, we determine the healthy weight by a couple different things. One is a simple thing would be a body mass index, where we calculate the height and weight. We put it into a formula, and if it is 25 or above, they're considered overweight. 30 is obese. 35 is more moderate obesity, and 40 is severe obesity. With those things, we can approximate how much weight they can lose. We do have a special body composition analyzer in the office that people have access to. It can actually determine how much muscle mass you have, how much body fat you have relative to somebody else, your certain age and height and sex. So it can calculate to the pound exactly how much excess fat a person has and how much muscle they have, so that when they lose weight with us, we can make sure it's the healthy weight and not just more muscle weight.
Okay. And Otia, tell us a little bit more about the in-body composition. What is it about and how it does help us, medical providers, to help our patients?
It is such a cool tool that we use for our patients to gauge weight loss. The initial in-body is done at the patient's consultation. So it's giving me the weight that they have at that point. It's giving me the muscle mass that they have along with the visceral fat and percentage body fat in real time. So when I go over with the patients what obesity is, it gives a snapshot of where the fat is, and they go, oh, they have a better understanding of, okay, so my percentage body fat is this number, but in comparison to what? In comparison to women or men your age and your height. So then on this in-body, it gives you your goal, if you will, or the average for the person that might be the same makeup as you. So as the patient is losing weight, we're getting closer to those normal numbers, and they're getting excited and they're understanding the difference between this percentage body fat that's underneath the skin versus the visceral fat that's internal around my organs. So the patients have a very good understanding of what obesity is to them as an individual and with losing weight. So again, we do it the first initial visit, and then we do it month to month as they lose weight.
Yeah. So another question that I normally get is, why do we draw labs here in our medical weight loss? And I think that's one of the things that makes us different as well, is the fact that we're actually taking a look at your overall health. So we are just a very comprehensive program in which we're looking for factors that could be contributing to weight gain. Mm-hmm. So we may have patients that are on medications that are leading to weight gain. So we are addressing that as well. So I think that's really what makes us very different. So we can also monitor that in the long run. So we see these patients on a monthly basis, so we can really see that progress.
We're doing some labs that some PCPs might not do. So
Right.
A patient might say, I've been told that I have PCOS, but I'm not sure.
Yeah.
What test can you run for that? I've been told that my mom has thyroid disease, and she said I might be gaining this weight because now I have it. So there are tests that aren't being done in their regular office, or add-ons that we do, which will help to identify these underlying conditions that's causing the weight gain. So we're screening for those
And we're
things.
also screening for nutritional deficiencies, which is huge, important in people who have excess weight.
Correct.
Vitamin D can be very low. Vitamin B12 tends to be very low in patients, and they don't often get the screening processes done in their primary care physician's office to be able to determine that. And when we replace some of those things, they have a lot more energy and are in a better place.
Correct.
To figure out if what kind of weight loss they want to do.
Mm-hmm.
And when I think we can also dedicate the time to the patients, since we really are, that's our main focus, is we want to get you healthy.
Right.
So we are the Center for Weight Management, and we are located in our Sewanee, Brazelton, and Gainesville office. So give us a call.